Hi, my name is Jennifer Zuberka. I will be performing an intramuscular injection into the Vastus Lateralis site. I will be using the Z-Track method, and I will be mixing my medication between from a powder and a diluent. The first thing I'm going to do is perform hand hygiene, and I'm going to check the 6 rights of medication with the physician's orders and the medication administration record. The 6 rights are the right patient, the right medication, the right route, the right dose, the right time, and the right documentation. Now that I have done that, I am going to prepare my medication. This medication here can be mixed in 3 strengths. It can be mixed as 300 milligrams per milliliter, 400 milligrams per milliliter, or 500 milligrams per milliliter. I will be using the 400 milligrams per milliliter dosage strength, which requires me to add 7.1 milliliters of diluent to the powder. Before I do that, I am going to check my vials to ensure that they are not expired and that there are no cracks. I will take the caps off, and I will clean the tops. Okay, next I'm going to use a 10 milliliter syringe so that it has the capacity to hold the amount of diluent that I need. And I'm going to attach the needle. Now I need 7.1 milliliters of diluent. So I am going to draw 7.1 milliliters of air into my syringe. Remove the cap. And I'm going to inject the air into my diluent. Then I'm going to turn it upside down so that I can draw out 7.1 milliliters of the diluent. I'm going to ensure that I have the correct amount of diluent in my syringe, and then I'm going to inject the diluent into my powder. And then I am going to put this needle into the sharps container, and I'm going to mix my medication. Once it is thoroughly mixed, I am going to use a smaller syringe because I am going to give my patient 400 milligrams of medication, which will be 1 milliliter. So I'm going to prepare my syringe, and I will clean the top of my medication vial one more time before I draw up my 1 milliliter. And before that, I will put 1 milliliter of air into my syringe, inject that air into my medication bottle, and then I will draw the 1 milliliter of medication into my syringe. I am going to recap that with the one-handed technique and ensure that I have the correct medication in here. And while I'm going through this process of getting my medication ready, I will have performed the 6 rites for the second time. Now I have my medication ready and I'm ready to see my patient. So I will put on clean gloves and I will verify that I have the correct patient with 2 identifiers. To locate the correct place on the patient, I am going to form a rectangle with my hands using the correct landmarks. And the center of this rectangle is where my Vastus Lateralis injection site will be. I will clean the area in a circular motion, working from the inside out. And then to use the Z-track method, we will use our hand to displace the skin. So while we are displacing the skin, we will insert our needle at a 90-degree angle. While continuing to displace the skin, we will aspirate. If there is no blood return, we will inject the medication. This needle we can close with our safety cap, and then we will let the skin go so that it goes back to its normal placement. We will return our patient to a safe, comfortable position and dispose of the needle in the sharps container, and we will perform the correct documentation. Thank you.